A 77-year-old female diagnosed with CVA and right femoral neck fracture is referred to you, the nutritional consultant, on the third hospital day for nutritional build-up since the patient is unable to feed herself. To help manage this patient, we must first understand the nutrition support therapy for the critically ill. When patients have problems with eating or digestion, it is sometimes necessary to provide nutrition with artificial food which is specially formulated to provide the right balance of fats, protein, sugars, vitamins, and minerals. These artificial preparations can be delivered into the gut to be absorbed in usual way, which is known as enteral nutrition. Alternatively, they may be delivered into the bloodstream through a drip to bypass the gut, which is known as parenteral nutrition. Enteral nutrition. When would the patient require enteral nutrition? When a patient has difficulty eating and if the GI tract is working, patients who can take much nutrients from food because of diseases that impair the GI system. Enteral access. Enteral nutrition is most commonly delivered into the stomach or gastric feeding. The different access can be through the nose or the jejunum. Types of enteral formulation. First is standard, which has simple and complex carbohydrates, long-chain fatty acids, essential vitamins, minerals, and micronutrients, then concentrated. Critically ill patients frequently require less volume intake but packed with nutrients. Composition of enteral feeding. Enteral nutrition is composed of high-protein diet, carbohydrates of 49 to 53% and fats of 29 to 30% of total calories. However, there are components that are not recommended such as omega-3 fatty acids, antioxidants, and glutamine which can lead to diseases affecting the brain. Ornithine, ketoglutarate, prebiotics, and probiotics. Arginine, fiber that can cause bowel dysmotility. Complications of enteral nutrition. Aspiration, diarrhea, metabolic effects such as hyperglycemia, fluid or water, for instance tube clogging, mechanical, and constipation. Parenteral nutrition. It is an intravenous administration of nutrition which may include protein, carbohydrate, fat, minerals, and electrolytes, vitamins, and other trace elements. Who will benefit from parenteral nutrition? Anyone who cannot or will not eat or cannot maintain their fluid or nutritional status by oral or tube feeding. How is parenteral nutrition being delivered? Parenteral nutrition access options may include central venous catheters, peripherally inserted central catheters, Hickman catheters. Components of parenteral nutrition. It is an admixture of solution containing dextrose, amino acids, and electrolytes, lipids, vitamins, and trace elements, glutamine. How should you monitor the patient? Weight, CBC, electrolytes, and BUN should be monitored often. Fluid intake and output monitor continuously. Plasma glucose should be monitored every 6 hours. Aminotransferases, bilirubin, and triglyceride at least once a week during treatment. Full nutritional assessment should be done at 2-week interval. Complications of parenteral nutrition. Infection in the blood, metabolic effects like serum electrolyte abnormalities, vascular injury. Goals of management. The aim of enteral and parenteral feeding is to provide nutrients and supplements in anyone who cannot feed via orally to avoid malnutrition, provide wound and healing and clinical outcomes, and to prolong life in someone who is critically ill or an older person. Thank you for listening.